Good afternoon, dear patients. Today we will look at a clinical case presented in the picture. A man came in with redness of the glands in the periurethral area and a little further along. Accordingly, he was concerned about increased sensitivity, the presence of redness, and a slight burning sensation in the area of these eruptions. He is sexually active only with his wife. By the way, right now about half of our patients are like this. Accordingly, tests for sexually transmitted infections were taken, as well as bacterial cultures from the urethra and a smear for inflammation or a flora smear. As a result, everything is fine in flora. Inflammation was detected at 10 to 12 leukocytes, with the norm being up to 2 to 3, and accordingly, Gardnerella was found to be positive. By the way, my wife also had it. Gardnerella. The man expressed a desire to be treated with pills. At first, here. Basically, he was prescribed Metronidazole for 5 days. Accordingly, 3 weeks later, he took a follow-up test. He still had Gardnerella. Meanwhile, his wife was being treated by a gynecologist. I can't directly speak to her treatment process. I can't tell you, I don't know, because she was treated by a gynecologist at her place of residence. Consultation format? Accordingly, during the treatment period, there was no contact, at least that's what the patient claimed. Accordingly, he decided to undergo comprehensive treatment after all. He was prescribed Tiberal urethral irrigation and intramuscular Longidaza. As a result, yes, this patient was also prescribed topical treatment. Metrogyl gel was applied to the glans penis. As a result, this patient achieved a complete recovery. At the follow-up test 3 weeks later for Gardnerella and inflammation, all results were negative. This indicates that Gardnerella is not such a harmless parasite for the male body. It can cause inflammatory changes both inside the urethra and on the glans penis. Currently, Gardnerella should be treated comprehensively. The gynecologists at our medical center also note that Gardnerella has become quite resistant to various medical drugs, especially if the treatment is not comprehensive. With so-called pill doctors who just try to prescribe a few pills and be done with the patient, this approach may work in a clinic setting, but unfortunately it is not good. Often it is detrimental for patients.